Jason is so sad. He had been excited to see his grandfather, especially because they have a history of fun times together. Sadly, this time, the grandfather reacted strangely. He can't seem to remember Jason, and no, he really can't remember his grandson. Uh-oh. Don't be sad, Jason. Your grandfather has Alzheimer's disease, and as such, he can't remember you. Not to worry. In this lesson, we will learn about some diseases or health concerns, how they are pronounced, and some other important information associated with them. Let's begin with Alzheimer's disease. Alzheimer's, spelled ALZHEIMER', is a degenerative brain condition that impairs memory, thinking, and behavior. It is the most frequent form of dementia in older people. It usually develops gradually and gets worse over time. Unfortunately, there is currently no cure for Alzheimer's, but there are treatments available to help manage the symptoms and improve quality of life. Next is pneumonia. Pneumonia, spelled PNEUMONIA, is an infection that affects our lungs. It can make it hard to breathe and cause a cough, chest pain, and fever. Pneumonia can be treated with medication, rest, and plenty of fluids. So if you thought pneumonia was contracted through a cold, you were wrong. Now let's explore a common disease that is a bacterial infection called Helicobacter pylori, typically known as H. pylori. H. pylori, spelled HELICOBACTER is a type of bacteria that infects the stomach. It can cause ulcers, stomach pain, bloating, and even lead to stomach cancer in some cases. Fortunately, H. pylori can be treated with antibiotics and medications prescribed by a doctor. Next, we'll explore a highly contagious bacterial infection called tuberculosis, often referred to as TB. Tuberculosis, spelled TUBERCULOSIS, primarily affects the lungs but can also impact other parts of the body. It causes persistent coughing, chest pain, fatigue, and weight loss. Thankfully, TB can be treated with a combination of antibiotics taken over several months. Moving on, let's talk about a chronic condition called diabetes. Diabetes, spelled DIABETES, affects the way our bodies process glucose, a sugar that provides energy. There are two main types of diabetes, type 1 and type 2. Type 1 diabetes usually develops in childhood and requires insulin injections, while type 2 diabetes is more common in adults and can often be managed with lifestyle changes and medication. Next is a disease that you've probably heard of before, cancer. Cancer is a group of diseases characterized by the uncontrolled growth of abnormal cells in the body. It can affect various organs and systems. Treatment options for cancer include surgery, chemotherapy, radiation therapy, and targeted therapies. The chances of curing cancer depend on the type, stage, and individual factors. Next is a viral infection known as hepatitis. Hepatitis, spelled HEPATITIS, refers to inflammation of the liver. There are different types of hepatitis such as A, B, C, D, and E each caused by different viruses. Symptoms can range from mild to severe and may include fatigue, jaundice, abdominal pain, and nausea. Treatment for hepatitis depends on the type and may include antiviral medications, rest, and supportive care. Have you ever heard of a serious infection called meningitis? Meningitis, spelled MENINGITIS, is the inflammation of the membrane surrounding the brain and spinal cord. It can be caused by either bacteria or viruses, and in some cases, even fungi. Meningitis can lead to severe headaches, neck stiffness, fever, sensitivity to light, and even neurological complications if not treated promptly. Its treatment depends on the underlying cause and may include antibiotics or antiviral medications, along with supportive care to manage symptoms and prevent complications. Fantastic! You've now learned about some frightening diseases. Remember, expanding our knowledge about diseases empowers us to take better care of ourselves and those around us. Take good care.